An Investigation into the Research and Treatment of Autism by William Longpre, Wendy Parker, and Janalee Sexton. In this presentation, our team will look at a definition of the disorder as found in current literature. We'll give an overview of the significance the disorder has in the counseling field. We'll look at the effects this disorder has on minority populations, give different methods employed to treat the disorder, and at the end we'll give our perspective on the disorder and how it might be addressed in future research. So what is autism? The definition of this and other such disorders has undergone multiple changes over the past few decades based on research and understanding of how the disorder works. The DSM, or Diagnostic and Statistical Manual of Mental Disorders, which serves as a primary aid for clinicians, had its definition as early as 1952, and that definition has changed multiple times up to the current 5th edition of the DSM, also known as the DSM-5. The term autism is a shortened term for autism spectrum disorder, which refers to a group of neurodevelopment disorders grouped into one basic category. The basic description of this disorder is an impairment of social and socialization skills, expressive and receptive communication, and repetitive or stereotyped behaviors and interests. The basic way to understand this disorder is that it's a communication disorder. Since it's a spectrum disorder, it ranges from the low end of the spectrum being a simplified impairment of communication abilities or an inability to interact as well with others as a normal person, to the higher end of the spectrum, which impairs most communication skills and prevents one from interacting with people almost at all. So how is autism diagnosed? Going off the DSM-5, they have 5 different criteria that a person must meet in order to be diagnosed with autism. The first is persistent deficits in interactivity and communication skills with others. This is the communication and interactivity skills that we discussed before. This includes emotional engagement with others, or nonverbal communication, or just maintaining healthy relationships with others. The second is restricted, repetitive patterns of behavior, interests, or activities. This can include motor or verbal tics, obsessive, ritualized behavior or thinking patterns, abnormal fixations or preoccupations with objects or situations, and hyper or hypo-reactivity, this being either over-the-top or underwhelmed reactions, respectively. And this is when it comes to sensory input, usually extreme input such as loud noise or pain or temperature differentials. The third is that these symptoms must be present in the early development period of a person's life. The fourth being that they must also be clinically significant, meaning that they have to actually be causing a significant deficit to a person's social skills. The fifth being that there has to be no other clinical explanation for these symptoms. Autism has to be the diagnosis that explains all of the symptoms that the patient is displaying. Now, as mentioned before, autism is a spectrum disorder. This means that it can range from low to high, meaning that it can't just be one type of disorder. It can range from the person might be on the lower end of the spectrum or on the high end of the spectrum. The DSM-5 has described this scale in 3 different points, with level 3 being the highest and level 1 being the lowest. Level 3 is defined as requiring very substantial support. This is someone who needs assistance in their day-to-day activities. It means sometimes that they have communication disabilities to the point that they can't actually communicate with others, and that they require assistance in just normal daily activities, such as mentioned before, dealing with sensory input, or just dealing with their ritualized behaviors. Level 2 requires substantial support. This is someone who is still able to maintain a certain level of independence, but they still require a significant amount of support. And then level 1 is someone who just requires basic support. They can still function independently as a person, but they might require a little assistance, maybe even a few verbal or physical prompts to stay on task or to engage with others.
Counseling is especially important to those who have been diagnosed with autism spectrum disorder, not only for them, but for those who are their caregivers, family, and friends who interact with them that can help support them and help them lead a more productive life. There has been a lot of research on how to help children with this disorder in regards to social interaction, in regards to the potential developmental delays that occur with those with this disorder. But there's also many treatments that are available for families through group therapy, through structural family therapy, cognitive therapy. So the counseling profession as a whole has the ability to help those individuals with this disorder. And so there's a great need for continued research to help adults as well. Through national, state, and district level research, autism is less likely to be diagnosed among minority populations. Reviewing special education eligibility data, they indicated that minority students with autism are under-identified when compared to their white counterparts. Children with autism fare better when provided with intensive evidence-based interventions. Autism's identification continues to vary by race, both within and between states, and the presence of new racial categories has clarified under-identification of minority students in this eligibility category. Continued research is important to make sure that all races are identified for autism so that all individuals have the ability to receive services.
General treatment and intervention concepts. Because autistic spectrum disorder, or ASD, is a complex disorder, there are many different treatment options available. However, a few general concepts apply for all interventions used in the treatment of ASD. Early intervention is very important in the treatment of ASD. Research has shown a strong correlation between how soon early intervention begins and better treatment outcomes. Family-centered approaches are important when working with individuals with ASD, especially when working with younger children. An example of a family-centered approach would be teaching parents to embed a behavioral strategy, such as the use of a visual storyboard, into a child's nightly bedtime routine. Strength-based approaches focus not just on the child's problems, but also on the inherent strengths within the child, their family, and their communities. Children with ASD are known to have strong visual skills. Therefore, the use of a picture-based alternative communication system would be an example of an intervention that uses the strengths of a child with ASD. Interdisciplinary team. Because ASD is very complex, each child will often have a variety of professionals working with them at one time. The more these professionals can communicate as an interdisciplinary team, the better the outcomes of each individual treatment and/or intervention will be. Optimal independence. Finally, it is important then the end goal of all intervention focus on the final outcome of helping the child with ASD reach their highest level of independence. Ideally, these individuals will work in part-time or full-time jobs and may even live independently when they reach young adulthood. Treatment and intervention for autistic spectrum disorder. Common interventions that may be used with individuals who have ASD include occupational therapy, speech-language pathology, physical therapy, behaviorists, biomedical interventions, and special education teachers. Counseling strategies. Mental health therapists can be involved with children, adolescents, and adults who have autistic spectrum disorder in a variety of ways. Behavioral intervention. Mental health counselors have skills that are beneficial in helping address the behavioral issues of children with ASD. Behavioral therapy and cognitive behavioral therapy are the primary methods of addressing these issues. When working with individuals who have ASD, there will need to be some modifications made, such as the use of concrete instructions, the use of visual aids, and possibly the involvement of a parent. Research has shown behavioral approaches to have positive outcomes in managing the challenging behaviors in this population. Treatment of comorbid mental health issues. There is a high prevalence of anxiety disorders, depression, and disruptive disorders among individuals with ASD. One possible reason for this is that these individuals want to have friendships, but they do not necessarily have the social skills needed to make and keep friends. Also, many children with ASD may experience bullying at some point. In both cases, behavioral therapy and/or cognitive behavioral therapy is usually the most common approach. Role-playing with the therapist and/or a parent has also been shown to be effective in helping children with ASD learn new skills, especially social skills. Social skills groups are helpful for school-aged children and can be especially helpful for adolescents and young adults with ASD. Explicit training and practice of social skills, such as initiating social interactions, correctly interpreting verbal and nonverbal communication, and learning how to use empathy are all important points of focus. When these skills are combined with community-based activities, there is greater generalization of these skills into peer relationships. Treatment of parental mental health issues. Parents of children with ASD have a higher prevalence of parental stress, depression, and anxiety than parents of typically developing children. One possible reason for this is the great amount of responsibility these parents have in meeting the needs of their children. Two interventions that have been shown to be helpful are teaching parents better coping strategies and helping parents build a social support network. Therapists can be involved in individual counseling with parents, family counseling, and also in the leading of support groups. After doing our research, we had some concluding thoughts about autistic spectrum disorder. First of all, we all noted that there's a high prevalence of ASD in our society. And because of that, there's a great need for research to be done to identify the causes of autistic spectrum disorder. Hopefully, if we can find what causes this disorder, preventative measures can be taken, and then children will not have to deal with this disorder in the future. Early diagnosis is another thing that we noted. Research has shown us that children with autistic spectrum disorder who are diagnosed at an earlier age generally have better outcomes because they can begin early intervention at an earlier age. Education. There is a great need for accurate education. First of all, our professionals need to understand the disorder so that they can treat it effectively. Especially our pediatricians are usually the gatekeepers and the first people to diagnose this disorder. Parents need to know and understand the causes, symptoms, and the available interventions. This disorder is very complex, and so knowledge for these parents is power. It helps put them on the right path to help their child. And it's especially important for these parents to know their child's behavioral issues do not necessarily reflect their parenting skills. It is the disorder. Interventions. We have noted that there is a gap between what we know about autistic spectrum disorder and how we apply that into our interventions. We call it a science to service gap. So there's the need for development of evidence-based interventions in order to bridge this gap. And also, there's a need for interventions that are specifically designed for adults with ASD. We have a lot of interventions for infants and young children and older children and even adolescents, but not very much available for adults. We want our young and older adults to reach their optimal independence and thrive within society. Family support. When working with families who have children with ASD, it's really important to remember that we're not just treating the child with ASD, but we're also treating the family unit. From research, we know that parents who feel supported do a better job in parenting their children with ASD. A few ways that we can do this as mental health counselors is by providing individual counseling, marital counseling, family counseling, and also helping to lead support groups. Trained mental health professionals. With the high prevalence of ASD within our society, there is a need for mental health professionals, especially those within our community mental health centers, to have training and understand how to treat individuals with ASD. Because of the high prevalence of ASD, there's a great probability that many of us will work with these individuals at some point in time. And finally, community support. Our communities have the opportunity to reach out and support these families in a variety of different ways. A few ideas that I wanted to include were respite care for families, support groups, and church support.